Hello, everyone. Good afternoon, everybody. I am Geet from our Radiance with You YouTube channel. I am sure all of you must be keeping good health. Today, we are talking about something that affects everyone, no matter where you live, fungal infections. We are going to have an important chat about them and how we can stop them from spreading by taking action very early on. Fungal infections like athlete's foot or nail fungus might not be the first thing we think about when it comes to health, but they are important and can cause serious problems if we ignore them. They can make us really, really sick if we don't deal with them properly. Fungal infections from happening and talk about the latest treatments. This month is all about being aware of fungal infections and how to stay healthy. So let's connect today with our skin expert, Dr. Seema Srinivasa. Dr. Seema Srinivasa is an eminent dermatologist and cosmetologist. She is the director and chief dermatologist of Dr. Seema Skin Care and Laser Center. Having completed her post-graduation in dermatology and venereology at MBJ Medical College Hospital and Research Center, she has completed multiple fellowships in cosmetology with more than 10 years of experience in this field. She is committed to patients' cares and innovative treatments in cosmetology. Her special interest includes treatment and anti-aging therapies. She is truly a patient-focused dermatologist and experienced in skin health in providing preventive skin care to adults and children. It is a pleasure to host you, Doctor, today with us.
Thank you, Geet. First of all, thank you for such a lovely introduction. You've been too kind to me. Thank you for having me here. And I hope I'll be able to, bust some myths and, help people as much as I can.
Sure, ma'am, definitely. And as I mentioned in my introduction as well, that fungal infection is not the very first thing which comes to our mind when we talk about health, but definitely one of the most prominent and the most important things, which I think, and I guess all our viewers would agree, that everybody should have a fair amount of knowledge too, because these days in a modern world which we are living in, already the work is so much that we usually travel, we work, and everything happens in a sudden, fast, and digital pace. So taking care of yourself is definitely a must.
Definitely. I cannot agree with
Yes.
this anymore.
Sure, ma'am. So I would ask you some questions today over this,
Yes,
and please allow me to ask you the first question about the fungal infection. That what are the
sure.
most prevalent fungal infections in our region, and what prevention strategies do you recommend for them?
First of all, when we talk about fungal infections, we have to understand that each and every one of us can suffer from fungal infection. Forget about the socioeconomic status, forget about how clean you are, not clean you are. All of us are definitely affected with fungal infection at one point in our life. So, the most common fungal infections that we encounter these days are fungal infections called as tinea. Are the type of fungal infections that mainly affect your body, especially your skin folds, wherever it is very warm and very wet. Those areas it is commonly affected. So, what was your next question?
Ma'am, followed by the same, and what prevention strategies do you recommend
Okay.
for?
There are a lot of prevention before you can even suffer from fungal infection. There's a lot of ways we can prevent it. So one of the foremost is a reason, or one of the foremost ways to prevent it is by having a good personal hygiene. That is going to help you on a long run, especially with India being a tropical country, with us having such strong, harsh summers. We tend to sweat a lot, and there's a lot of heat generated all over us. So we have to make sure that we have frequent baths, try to maintain our hygiene. There are a lot of things. As we go, I can explain to you each and everything. The basic one would be to maintain a good personal hygiene.
Definitely. And ma'am, are there any specific, as we are on the subject of hygiene, so if there are any specific populations that are more susceptible to fungal infections, and if so, what preventive measures should they take towards it?
Yeah, there is definitely, like I said, it affects all of us. That one thing is for sure. But we've seen predominantly it affecting people with the social economic lower social economic status who are not able to maintain their personal hygiene, people who travel a lot, for long periods of commute where they cannot really help with the sweating and constant heat generated around them, that causes excessive chances of having an infection. Sports people, sportsmen, your athletes who are constantly running around and sweating, who generate a lot of perspiration, they also are affected to a large extent. People with very less immunity, people who are suffering from comorbidities like your diabetes or any other thyroid issues or hypertension, who do not have their own immune system to fight against these simple fungal infections, tend to be the population who suffer the most from fungal infection.
Okay,
And to
ma'am. And
treat
can
it,
you
like that, yeah, like you said, it's very simple. If you're not maintaining a personal hygiene, please make sure you maintain it. If at all you have to do a lot of travel, just make sure that you carry an absorbent powder with you or something like that to prevent it on a day-to-day basis. And sports athletes, so we know that they have to have baths before or after having their extreme sports. That is definitely going to help them.
definitely, ma'am. And often these days we speak about hygiene, but I guess it is the number one thing which everyone definitely should follow. So, ma'am, can you please provide guidance on how to recognize these early signs and symptoms of fungal infections? Because usually there is a rash or an infection, but we do
Correct,
not
yeah.
tend to treat them well. So, what are the early signs and
Yeah.
symptoms of fungal
So
infection?
first and foremost, we have to educate the people and tell them how to recognize whether it's a normal rash, insect bite reaction, or whether it's an autoimmune conditions like your psoriasis, or whether it's very well because they are well demarcated. They are circular. In layman's term, we call it as ringworm infestation. So you see that there is a typical ring that is formed on the skin with a central clearing. That is the center part of the infection is usually clear. You have normal skin, but you see a ring formation where the fungus has leading edges. That is, it is constantly growing. These edges are usually very reddish, very flaky, scaly lesions. It can also have a couple of pustules. If they have itchy rashes, especially in the skin folds, like your groin area, underarm area, under the breasts, all these areas are prone for fungal infection. So these are a few characteristic features that we have to educate the local public how to recognize it and how to treat it as early as possible.
Right. Ma'am, and as we were speaking about hygiene and personal hygiene, what would be the practices on day-to-day basis in a day-to-day life that we would recommend to our viewers?
So, especially in summers, I would definitely say we have to have bath at least twice in a day, just so that we remove all the dirt and grime and any sweating that can be a good source for fungal infection to grow. Secondly, in summers again, see we see that fungal infection usually comes in summers or in monsoons when the weather is humid, when the weather is very hot. So it's always better to wear loose cotton clothing. Make sure that all your clothes are washed separately. Do not share your towels. Do not share your soaps. Make sure your combs and even your socks have to be washed separately. Do not share combs as well. And you have to wash it in either hot water or put it out in the sun. If at all it is monsoon season and there is hardly any sun or your clothes are getting wet very often, make sure you iron them inside out because the body part that is touching the skin has to be ironed or heat generated so that all the fungus or the dermatophytes that are there kind of dies off. So this is something that they have to practice on a day-to-day basis. It is important if at all they are suffering from fungal infection, they meet a qualified practitioner, either a physician or a dermatologist as early as possible because fungal infection is contagious.
Okay.
Contagious in the sense it can spread from one person to another. So it is also important that the entire family is treated.
Okay.
Okay?
Yeah.
Yeah.
And ma'am, because we are on this same subject of different climates. So there are environmental factors also which increases the risk of fungal infections. So how do individuals should mitigate their risk?
So, like I said, in monsoons, if you're not able to, dry your clothes, make sure you iron them. In summers, yes, you have enough sun, you sun dry them thoroughly, have baths repeatedly, not repeatedly, at least twice in a day. Maintain your personal hygiene well. Do not share it. All these are there. So in summers, there are certain things you can do. In winters, there are certain things there. But the basic idea is maintain personal hygiene.
Oh, definitely, ma'am. And apart from the hygiene and environmental factors, as you were speaking about a higher immunity. So, there are any dietary or lifestyle habits that can help boost a good immune system so that we can reduce the risk of fungal infections?
Yeah, definitely. But there are no specific diets that can eliminate fungal infection. See, you have to understand that fungal infection is a superficial skin infection, right? So anything that you eat will not directly affect by, destroying the fungus. But yes, foods like good in vitamins and minerals or anything protein rich diet, all of these are going to help boost your immunity. Once your immunity is good enough, even if you do have a simple fungal infection, your own body will be able to fight against it. So that is the key in your diet. Lifestyle changes, like I said again, and I repeat repeatedly, is maintain a good personal hygiene. So you have to make sure that, in summers you wear loose cotton clothing, the same thing goes on. So if you can maintain these basic 4 or 5 things on a day-to-day basis, it is definitely going to make sure that, you're curtailing the fungal infection from spreading.
100%. And this brings to my next question, Doctor. What preventive measures can a healthcare professionals take to minimize the risk of nosocomial fungal infections?
Okay, so most importantly, we have to bring about awareness. We need to educate the layman, the local public, what is fungal infection, how to differentiate fungal infection, what are the basic things that you can do when you are getting a fungal infection, and how to prevent it. That education and awareness is very important, first of all. Secondly, when the patient comes to you, you have to educate them on how to take care of themselves. The preventions you have to educate, the risk factors you have to educate them. Thirdly, what you also have to tell the patients is not to go seek help from a local pharmacist. Pharmacists do not know how to treat fungal infection. Usually, what happens when they go to the local drugstore or the chemist or the pharmacist, what happens? They usually give an anti inflammatory ointment or a cream, which mainly consists of steroids, topical steroids. Topical steroids will just bring down the inflammation for 1 or 2 days. That is, if you have a red rash and it is fungus, for 1 or 2 days, it will give you an impression like it's completely gone. But the problem with steroids is the more steroids you apply, it is like you're feeding the fungus. It is only going to take all of the steroids and grow stronger. Not just that, once your fungus has grown stronger, it becomes resistant to any of the treatment that a dermatologist or a practitioner gives. So it becomes very difficult even for us to treat the person. We have to treat them on a long term basis. We have to treat them with stronger antifungals, which is totally uncalled for. So, educate the patient, tell them how to take care of their skin, tell them not to go and apply creams that are just available in the pharmacy just to pick up. They go and say, I have a rash, and the pharmacist gives them a drug, which gets complicated, and they come back to us with complications. So that is something that is definitely needed, that we, kind of tell the patients what to do and what not to do.
Definitely. And ma'am, are there any advancements in the therapies, in the preventive therapies or vaccines for the common fungal infection?
No, not vaccines, especially for superficial fungal infections, but there are multiple antifungals that are there in the market. Lovely studies have been done backing it up. There's topical treatment, that is creams and lotions to apply over fungal infections. There is oral medications also, because only giving topical treatment in case of fungal infection sometimes is not sufficient. You need to treat them orally. You need to eradicate the fungus itself. So that is very important. Yes, there are multiple new medicines that are there, which works very well. We also have to understand that because of this pattern of using corticosteroids or topical corticosteroids by patients, the antifungal resistance is also on a high. So we've seen that many antifungals that were working maybe 2, 3 years ago do not respond anymore. So constantly they're coming up with different types of antifungals, seeing, okay, does this work? Has the fungus formed resistance to it? So a lot of this has to be done on a a day-to-day basis. So I would always say, don't take medicines on your own. Come and meet your doctors; they'll be able to guide you. Even after giving medicines, there is resistance. So you have to also tell the patients that you have to take the medicines for a long term period. Not just that, they have to take the medicines, the entire family has to be treated. So it is definitely going to be hard on their pocket. It's not going to be economical as such. So we see patient not being compliant. Patient compliance decreases. They stop taking treatment midway. They start applying their own types of medicines, and they come to us with a lot of complications.
Right.
Yeah.
And can you please provide us recommendations on the appropriate use of antifungal medications? Because as we were talking about the pharmacist suggesting something to the customer and they usually apply that and definitely come after the situation has gotten
Bad.
worse. So, according to you, what would be the recommendations on the appropriate use of the antifungal medications
So
on
yes,
preventive patient?
we have to tell the patients that oral as well as topical medications is a must. By telling them that only taking one of this will not really help them, they need to complete a course. The course can be somewhere between 3 weeks to even 3 months sometimes. And you have to educate them. There are certain body parts which, where, if they are affected with fungal infection, needs a little longer treatment than the rest of the area, especially like your nails. When you get onychomycosis, the treatment lasts for a couple of months, and we have to tell the patients that they have to complete that course. Most of the time they stop midway. In fact, I'd like to give an example. Just yesterday I got a patient who was taking treatment from me, had completely, the fungal infection had completely resolved. She left it. She did not continue the topical medications. Usually what I do, oral medications for a certain amount of time. After that, I ask them to continue topical medications, especially antifungals, for another 2, 3 months afterwards. But none of the patients do it on a regular basis because they see results in
Right.
2 to 3 weeks. They feel, okay, everything is gone. What is the point of continuing it? They don't understand that it is a long term treatment. So she came back to me with a relapse. I said, "What is it? You are completely all right. What happened? Didn't you complete your medication?" She said, "I took it for a month. After that, I didn't continue the topical medications. But my mother said it is always better that you can apply lime. In Kannada we call it as sunna,
Okay.
chuna or sunna, whatever."
Yeah.
So she's applied that all over her groin area and completely burnt her skin and come to me with complications. Now you tell me, how do I treat it? Do I treat it with antifungals? Do I treat it with antimicrobials because it's completely infected and there's a lot of secondary infections? So
Right.
patient education is the key. You have to tell them it's a long-term treatment and they have to finish it.
Definitely. And on do like this situation got worse. So do they involve any risks and any side effects as such?
With what?
Like the medicines and the medications,
The
both.
treatment, see, again, as long as a dermatologist or a practitioner is prescribing it, it should not have. See, we recommend it for a certain period of time where we know that there are no risk factors if you take it for certain amount of time. It is only when it goes beyond that is when there are complications. So if they're consulting your dermatologist or consulting a doctor and the doctor is recommending it for a certain amount of time, absolutely there are no side effects or risks. So
Okay.
you have to choose your patients also carefully. So if your patient is immunocompromised, you should know how long to give. If your patient is a child, you should know what dosage to give. All that definitely plays a factor. And who is going to decide all that? Your doctor. So a
Definitely.
pharmacist, or by your own, by seeing some viral hack or some internet trend, they cannot cure the disease completely.
Right, 100%. So, usually anything happens, this is a habit that we usually apply a ghar ka thing or anything which is close to us and
Mhm.
immediately try to solve a problem. But definitely, this one advice is for all our viewers and for everybody watching us today that definitely do visit a dermat and cosmetologist, even at a very smaller issue you find. on your skin. And ma'am, as we were speaking about compromised immune systems, so people who are dealing with already a weaker immune system, or maybe a patient with a diabetes who is a diabetic person, so what would be the best way to protect themselves from the fungal infections through preventive measures?
Mm. So especially when it comes to diabetics, they are very prone for fungal infections. One, because their immunity is quite less, and fungus tends to have an affinity towards, diabetes mellitus patients. They have a higher incidence of getting fungal infection. So first and foremost, you have to tell them to have a normal sugar level. They cannot have, erratic sugar levels and expect the fungus not to come at all. So that is something that they have to maintain. If they are on oral hypoglycemic agents, they need to take it on a regular basis. If they are on insulin, they need to take it. They have to make sure that their blood sugar levels are first within normal limits. Okay, if that is taken care of, half your battle is won. The second part is the same as what you would do for the rest of your patients. The advices that you give about, taking care of their hygiene, not scratching that area, maintaining a good, environment around them, making sure there is no source of infection, that they're getting reinfected. If there's anybody else in the family or elderly patients who are there suffering from the same thing, making sure that all of them get treatment are the simple things that we can educate them about. But first and foremost, if you're a diabetic, first make sure that your diabetes is under control.
All right, ma'am. Thank you so much for answering all the questions in such a detailed format. I'm pretty sure most of the problems and most of the queries which all our viewers have today are solved just by listening to all the solutions you gave. And now I would like to pick up questions from the chat box, as many of our viewers have posted different questions regarding fungal infection. So Rohit from our viewers is asking, how do fungal infection affect people with asthma?
See, asthma, what happens is these people tend to take a lot of steroids, right? So as one of the treatments for asthma is, either, inhaling steroids or oral steroids. But these people, they're already immunocompromised. The fungus tends to act more on immunocompromise. So they have to make sure that they have to be a little bit more careful than the usual population, because they are more prone to it. So they have to maintain the basic rules of fungal infection, how to manage themselves, and they have to take early treatment.
Right. So I am pretty sure, Rohit, your question has been answered. Moving on to the next one, Meena from our viewers is asking, fungal infection is cured by any home remedies? As we were speaking on the subject, ma'am, usually home remedies are the number one thing which usually comes in everybody's mind. So are the cures at home
So
available?
the cures for home remedy is to maintain your personal hygiene. That is the only home remedy I would give. Make sure that if at all there are any molds at home or any damp areas, that is taken care of at the earliest. Make sure that you do not contaminate. If there are multiple people overcrowding in the house, that has to be solved. There, not using and sharing others' clothes, not using garments, or using the same whatever soaps. All that is definitely important. These are the home remedies. But applying garlic, applying lime, applying onion, applying God knows what to the fungal infection is only going to complicate it. Fortunately or unfortunately, antifungals are the only home remedy that they have to take, and that too after consulting their physician or the dermatologist.
Definitely. So one pro advice to everyone is to consult your physician or a dermat
Absolutely,
in any
absolutely.
case. How does poor oral hygiene contribute to oral fungal infections?
Oral fungal infection,
Right.
especially in smokers, if they're not maintaining, if they're not brushing their teeth every day, or if they're not brushing their teeth even twice a day, if they are smokers, if they are diabetics, then the immunity is definitely going to go down. And oral mucosa is very prone for fungal infection, especially your candidiasis. So it is going to have. So they have to. There is no way that they cannot maintain oral hygiene. It is
Definitely.
extremely important that they have to maintain this one, oral hygiene.
Moving on to my next question, ma'am. Meenal from the viewers is asking, are there any complications associated with the untreated fungal infections?
Yeah, it is going to spread. It starts off with a single lesion usually, and then it can start spreading. We've seen patients with tinea corporis, that is fungal infection, all over the body, your feet, your hand, your scalp, your groin area, your axillary, that is your underarms. It can rapidly spread. So it is not only going to spread on you, it is also going to spread others. And it has unbearable itching, it is unsightly. So definitely untreated is an absolute no-no.
Definitely. And this brings us to our next question, which ma'am mentioned that it is definitely contagious. So, one question is, are fungal infections contagious and can reoccur?
Yes, absolutely. Fungal infections are contagious. It can transfer from your clothes, from your personal items like your combs and soaps. Even if you touch that part and touch another area, like you have fungal infection, you're scratching that area, and you touch another body part on your own body, it can spread. You do that and you touch someone else, it is immediately going to spread. So you may not see it
Definitely.
as immediate, but in the next couple of days or even weeks, you can see yourself developing another new lesion. So it is definitely contagious and it can recur. See, it's simple. Your fungus, your virus, your bacteria, once you get it and you get treated, it does not mean it will never come back. Like once you get your fever, or if you get your cold and cough, it does, and you treat it, it doesn't mean you'll never get cold and cough again, right?
Right.
Similarly, even fungal infections, once you get it, you're treated, you're completely healed, you can get it again. If at all you've been exposed to the fungus again, you can get it.
Definitely, ma'am. And what are the some over-the-counter options for treating the fungal infections?
Nope, nope, nope. No over-the-counter options. You can use your, absorbent powders. That is your antifungal powders, dusting powders. That maybe you can get it over the counter. That is still safe because that does not have a combination with any steroids. But any ointments that are available can have a high risk of having a topical steroids. So it is not going to help at all. Please consult your dermatologist or your doctor. They will be able to guide you.
Definitely, ma'am. One very interesting question, which I guess most of the pet owners and pet parents would have, that from pet does the fungal infection travels or can spread?
Can. So I wouldn't say that all of the pets will definitely be a source of fungal infection. Pets, especially when they are not maintained well, they've not given bath to the pet, they're not taking care of the pet, then a very high chances of the fungus affecting the pet. And then when you cuddle the pet, the skin to skin contact, you will definitely get it. But if the pet is maintaining a good hygiene, very less chance of the owner or the family members who have the pet or who's taking care of the pet at home will get it.
Definitely. And we have more questions coming up from our viewers.
Mm.
How do fungal infections adapt to different environments within the body?
So, see, there are certain areas on the body which is still very resistant to treatment. Like I said, fungal infection grows in areas which is warm and wet, right? So your groin areas, your under the breast, especially your underarms, all these areas you tend to sweat a lot. There is no aeration. So these areas, even though you treat them, even though you take care of them, even though you have a good personal hygiene, the higher chances of recurrence. So very slow to respond to treatment. So, and in areas, if you're living in a city or state where it's extremely humid, extremely hot, especially coastal areas, we see a lot of patients suffering from fungal infection every time it's humid and hot. So these are the areas we need to be a little careful about. And one more thing I'd like to add is people who are obese, people who are overweight, who have a lot of skin folds on them, they also tend to suffer from fungal infection more as compared to your normal population.
Okay. And ma'am, are there any skin types which are more prone to fungal infections?
No, not skin types, I would say. It is more to do with your immunity.
Okay. All right. Tony from our viewers is asking, can frequent travelers be at the higher risk of fungal infection?
Definitely, definitely. No, you're constantly traveling. You do not have enough bathroom breaks. You do not have time to, take a proper shower. You're not able to, dry yourself well. You're in a hurry. All these people, and especially people who are traveling to, states or countries which are very hot, which are extremely, prone to humidity and rain, all of these travelers are definitely prone to having a fungal infection as compared to the others.
Definitely, ma'am. And do we see most of this in summers or in monsoon? If I
This is the season. Summers and monsoons are the seasons. Winters, it's still lesser because we don't sweat as much
yeah,
and there is no heat, around us that much. So, yes, it's the summers, peak of summers and early monsoons is when we see a lot of patients. Even in my OPD, for the past 1 month, Bangalore being Bangalore, we've already started having rains, thank God for that.
yeah,
So, we are seeing a very high rise in patients coming with fungal infections because all these days they were complaining of constant sweating, there's no rain. Now that there is no rain, they're saying that the clothes are not drying.
right.
Clothes are not drying, again it's very damp, they put it on themselves, leads to fungal infections again.
Definitely. So that is the reason I guess winters are the most favorite. So because
Least affecting when it comes to fungal infection, but winter comes with its own skin
yeah,
condition.
correct. Uh,
So yeah.
and any more questions from our viewers? They can definitely post it up. One more question from Tony. From our viewers, are there any emerging trends or patterns in the incidence of fungal infections globally?
Yes, fungal infections are becoming resistant to treatment. That is the most disturbing bit of it all because of improper use of fungal antifungals, use of topical steroids, people doing their own remedies. The fungus is getting stronger and more resistant to any kind of treatment. So this is the growing trend that we are all, kind of fighting right now, all dermatologists, because we see so many patients, even though we used to give them a certain molecule or a certain drug for a month or so, it worked very well. The next year they come saying that I used the same medicine you gave me last year, which worked fantastically well for me, but this year it's not responding at all. So we know there is an obvious drug resistance to all the antifungals that is there. So we need to make sure, what medicine to give for what patients. That is why I'm constantly emphasizing on the fact that these patients need to see the doctor first. The doctor will be able to decide what antifungals to give, what oral antifungals, what topical antifungals, what are the other adjuvant therapies that we can give along with, the existing antifungals so that the patient gets faster relief, doesn't get a relapse or a recurrence.
And ma'am, what is tenure usually? What is the minimum time or the maximum time a person can go through a fungal infection?
Like I said, for onychomycosis, that is the nail fungal infection, we can give it up to 1 to 1.5 years also. The rest of them, it's somewhere between 3 weeks to 3 months.
All right.
So within that span, we usually tend to, we try to keep it within that.
Okay. And any more further questions? You can definitely post it up in the chat. We are getting a very detailed answers of all the queries that you have today, and our doctor on board is solving all your even the travel problems, even the at-home remedies, and everything to maintain a personal hygiene so you do not get contacted to fungal infections. And I would quote it again as ma'am said that definitely it is contagious, but it spreads from one person to another as well. So as a family unit also it is very important to take care of yourself so that it is not spread it to your family just because if you do not take your care properly.
Here, what we say is called as a blanket treatment. So we all often follow this in case of scabies. People who are suffering from scabies, we know that if one person has, the rest of the family also has. So we also try to treat the entire family, not as aggressively as the infected person, but we also give things like, your body wash or a soap or a powder to the entire family so that they can prevent it at the earliest. Otherwise, what happens is something called as a ping pong effect. So one person has, he gets better, he gives it to the other person. From that person, again, this person who's already been treated gets it. So it keeps, shifting between the family itself.
Okay.
So that is why the entire family being treated is important. Having said that, though we treat the entire family, it's not cost effective. People are not willing to spend, so they're not going to use your cream or a soap or a powder without them actually suffering from it. So until and unless they suffer from it, they will come to you for treatment. If we say, yeah, you use this, the rest of the family also use this, they'll be like, no, I don't have anything. Why should they use? So it's important that we educate them on the prevention.
Yeah.
Even before they get it, it's always better to prevent it.
Yeah.
So that education has to be done, and they will get that education only from the doctor.
Definitely. And as it has always been quoted that prevention is always better than the cure.
True. Yeah.
Yeah.
What I do, Geet, is whenever a patient comes to me with fungal infection or family or anybody comes to me, I make sure I give them a leaflet. Do's and don'ts of fungal infection or prevention and risk factors pertaining to fungal infection. And it's usually in the colloquial language, in the local language that is there, as well as in English, be it Hindi or Kannada or whatever language. I make sure that it's printed out in both the languages so that the entire family reads it. I give them a leaflet, I send it with them. I said, you read it, make sure you read it aloud at home so that the entire family listens to it. So at least, constantly they're being exposed to what are the do's and don'ts. They know how to protect themselves.
And that is such a great way of educating.
Yeah.
And
Definitely.
definitely it
Because
works.
whatever we say, once they get out of the clinic, half of it they forget.
Yeah.
So giving them a reading material always helps.
Definitely. And I'm pretty sure all our viewers would agree. So if there are any more questions, you can definitely put it up. And one question I guess I missed was, is the fungal infection also affect the facial area? Is it transfers with it?
Absolutely. There's something called as tinea faciae. It can affect the face, it can affect the beard area, it can affect
Okay.
your scalp. So there is definitely. So like I said, you touch that and you touch your face, that is going to come on your face.
Correct.
We see a lot of people to become fair. They use the spanderm, poderm, the quadriderm, betnovate, candid beam. All these have very high potent steroids. So they usually keep using it for years together on their face, but they are the ones who are very prone for fungal infection. They come to us with really reddish, topical steroid dependent faces. Along with that, we see one altered, morphologically changed fungal ring. So we immediately know, yes, they're using steroids. Yes, that affects the face. It can affect any part on your body.
Okay. So it is risky and definitely it can affect all the parts. So every part of your body should
It is
be
not that scary also, Geet. As long as you know how to prevent it and how to take care of it, it's not that scary. But until and unless we scare the patients, no, they will not listen.
yeah.
They will keep thinking, ha, ye to chala jayega, or whatever. It can be, it will go off in 1 or 2 days.
Yeah.
We have to kind of scare them a little bit. Otherwise, they will not listen to you.
Yeah, definitely. And yes, so promoting a self hygiene every day is a must. So any which ways they do not contact the disease, and if they have gotten any kind of infection, definitely they should always visit the specialist, because you cannot make decisions eventually for yourself. Your doctor can.
We've studied that. Our job is to, diagnose
Right.
and treat that. So it's always better they come to us so that we'll be
Yeah.
able to guide them better.
Definitely. Thank you so much, Dr. Seema Srinivasa,
Thank
for
you, Geet.
for being on board and giving your valuable time. It has been a very informative session. And as I said, it is great to hear you. And we really look forward to many more such sessions in the future. And thanks to all the viewers also for the active participation in today's session. And stay connected to our channel. Do not forget to subscribe our channel on YouTube. And thank you once again, Doctor.
Thank you, Geet. You've been a lovely host. Thank you. We've been able to give a lot of information out to the local public. I really hope it helps them and, they're better educated to take care of themselves and fight against fungal infection.
Yes, definitely. And definitely, as we aim to spread more and more awareness so that the layman, local people should get
Yeah.
more aware of it. So,
Yes,
sessions like this have been
definitely.
very useful to them. So, once again, thank you so much for your